Hello and a warm welcome to The Point. Health and education are two important drivers for any country's growth. As far as health goes, Prime Minister Narendra Modi has entrusted this responsibility to a man who's eradicated polio in the past. He's been the face of the Delhi BJP in the recently held assembly elections, and now this man is all set to check the pulse of the nation. I welcome Dr. Harsh Vardhan, who is the Union Minister for Health.
Thank you so much.
Welcome, sir.
Thank you.
So to begin with you, now with Modi at the helm of affairs and with the kind of governance which is now being talked about, do you think that the bars have really been raised for a ministry like health in terms of delivery, in terms of expectations?
You see, it's not only because Modi ji, you see, he is a well-meaning person. He has delivered in Gujarat and he has a very well-defined work culture which can be emulated by everyone who wants to do good work. And as far as the health ministry is concerned, I have been working in health earlier also, and we'll certainly replicate what we tried to do in the capital of this country. And now since I have been assigned the job to look after the whole country, we have to certainly work harder than what we used to do in Delhi.
But sir, in terms of priorities, the 100 days agenda which the government is talking about, what are the priorities in the health sector for you as a minister?
You see, first of all, let us make it very clear that there is nothing like a 100-day thing. I have to look after everything, and I have to see that the unfinished tasks in health are taken care of.
But sir, you haven't been given tasks which probably you have to complete within 100 days time?
No,
nothing of that sort?
We haven't been assigned any task like this. Obviously, we are looking at everything, because I strongly feel that you cannot prioritize things in a way that you are doing a particular thing now, you will do something later on, and then you will think of something next year. It can't be like that.
Do you think
because
but this 100 days is not working as a psychological deadline for the ministers?
I don't think there is anything like a psychological deadline or so. Right from the word go, I started, you can say, discussions, review, monitoring, and of course telling my vision to the health ministry officials.
Despite all the importance which you are talking about,
Yes,
which is associated with the health sector, it has never been on the priority list of the earlier governments. So what are you really doing in terms to, refurbish that kind of an image, that more significance and more prominence will be attached to the health?
I think we need to work very hard to make, to bring health to the center stage of politics, to the center stage of developmental goals,
right,
and to the center stage of governmental working, because I strongly feel that health, whether it is the positive effect on health or whether it is the adverse effect on health, somehow it is interlinked with how the other ministries also think, whether they are positively contributing to it, or whether they are contributing to it in a casual manner, or whether they are doing something negative to actually disturb the health.
But budget, sir, is around the corner. Have you been able to draw a blueprint, and have you been able to speak to Arun Jaitley, the finance minister, so that your priorities are accommodated?
Our ministry had one meeting with the finance minister. We have written to them a few things. We had our secretaries are deliberating with them. I will also talk to him, and I think the most important thing, unfortunately, in health, we are spending too little. If you look at the health spending in the GDP, it's around 1% or so, which is far lesser than what it should be.
But what is your rough calculation? What is the kind of expenditure
you
now?
See, my thinking is, you see, I will certainly ask for more money for health, and it's not in terms of percentage, but you see, whatever maximum the government can afford. Ideally, as I said, ideally it could be in a country like America, you are spending something like 17–18%. In UK, you spend something like 10 to 12%.
But is it somewhere near the aspirational level which you have thought?
I don't know how much this finance department is going to help us.
If I'm not mistaken, you probably are the first minister who's taken up the road safety issue in such a big way, especially after Mundeji's death.
Yes.
What are you really aiming at? Because never before have you seen a health minister talking about road safety. Trauma, of course, has been taken care of, but not
safety, not only the road safety, safety at home, safety at workplace, and safety in all forms is one of the major components of the healthcare delivery system. And I think it's not only the safety but the issues of occupational health,
right,
whereby any occupation that you have, whether you are working in an office or whether you are working on the road, everything has some hazards related to it, and everything has some preventive methods also, similarly for the environment. So all these issues have to be taken up in a big way. And
talking now, sir, about the health insurance, much has been talked about the kind of promises which you are making on health insurance for all. But in the past, we've seen that as far as the health insurance of elderlies is concerned, unskilled laborers, contractual laborers, they have never been accommodated in the scheme of things. How are you really going to target this?
You see, that's my dream. I would like everybody in this country to be under the universal health insurance scheme. And as on today, we have only some activity going on under the aegis of the labor department, especially for the below poverty line category. And there is a need to study the experience of the whole world. Some countries have done it in a good way. Some states in India have also done a little bit on that. We have to develop a consensus amongst the state health ministers. The central government has to play the role of a spearheading organization, and if we could achieve this goal, right, it is certainly going to help. And as you know, the priority of the government is the poor people.
But are you also looking at a time frame by when you will actually be able to do it? Because you're saying that you still have to evolve that consensus.
Time frame, I can't give you a specific time frame, but I think that in the next few weeks we will certainly set up a big group to be working on it in an organized manner.
Right.
We have already started deliberations. Many people have started working on it in some way or the other, because you see, it's not a very simple thing. But even though it is difficult, even though it appears Herculean, but I am committed to it, and I'll apply my heart and soul into it, see that this dream is fulfilled.
Right. But sir, another worrisome factor which is seen in the health sector is that when you walk into a corporate hospital, say for example Apollo or any other hospital, and for a surgery, like for example a bypass would cost you between 3 to 4 lakh, an incisive surgery, a minimal one which will cost about 1 to 2 lakh. So there is an unholy nexus which is seen between the hospitals and the insurance companies. Are you really thinking of overhauling the system? Because a lot of money people end up spending a big amount from their own pockets.
You see, I agree with you that I don't know, you call it unholy nexus or whatever it is, but it is a fact of life that world-class healthcare is available to only a handful of people in this country. Right. Not everyone can afford a treatment in an institution like Apollo. And of course, the insurance companies are also not working honestly in this country, whether it is due to a nexus or whether whatever due to rules or whether due to compliance of rules. So that's why we think that all this experience of the past has to be taken into consideration while we formulate our policies for the future, so that there is no exploitation in the system for the poor man at the end of the day, and for making the availability of access to tertiary care, good quality health care for even the poor people of this country. We have plans to make more AIMS-like institutions in this country. 6 are already in the offing, and there is a reasonable progress there, which I have expedited. The first thing that I did in the initial days was to take a detailed meeting, call these directors, talk to them for 2-3 hours, and we are in the process of planning.
But will you have those kind of resources to set up AIMS in each state? Is it not a very tall claim at the moment?
It may appear to be a tall target, but we have the resolve, and we have the determination to do that. I have already started working on it, and we have already spoken to the. We are making our agenda clear to the budget department also.
But sir, now coming to a very worrying trend which we have seen, you know, the entire life cycle of corruption which we have seen in health sector actually begins with the Medical Council of India. We have seen it in the past. How are you really going to make MCI free from the mafia-like grip of a few coterie of doctors? Are you really hopeful of doing that?
That's one of my passion areas, I would say, because I'll consider myself as a successful minister only after I have made health services available to the poor people of this country, and after I have revamped the whole Medical Council of India, because definitely it was, and it is to some extent even now, directly or indirectly, a huge den of corruption.
But so what about the state medical councils? They are also a den of vested interests at the moment.
You see, it's not that all the medical councils, all the people in the medical councils, they are dishonest people. There are many honest and sincere people also within the medical councils. But certainly there is no denying the fact that we need to do a lot to improve the image of the medical councils, not only to improve the image, to improve the actual working of the medical councils, and to actually ensure that the medical councils are basically taking care of the medical education in the true spirit. Because what we were taught 40 years ago in medical colleges, I find unfortunately the academic standards and everything seems to be deteriorating. When I ask my colleagues, how do you feel about your medical college, is it the same as it used to be when we were student there, or has it improved or deteriorated? The universal answer would be no, we don't find it improving, it must have deteriorated. So there is something very seriously wrong somewhere, and the Medical Council of India.
The quality of education, overhauling corruption in an institute like MCI, of course, is going to be a big challenge for you.
I know it's a big challenge, but Dr. Harsh Vardhan loves challenges, and in the past also I have never run away from challenges, and if there is no challenge in life, life is meaningless.
So another thing, out of the 60 pending legislations which a BJP government has inherited from UPA, 11 legislations belong to the health sector. The mental care health and the HIV bill, Drug and Cosmetics Act. Which legislation is on your priority list? Which are the legislations?
I would not say that any particular legislation, of course. I'm having a look at all these. I've already got a list with me, and I'm going to have a look at it. I think if there is nothing which needs any significant change from my angle, I'll certainly try to push preferably all of them as early as possible. So I'm taking my own time to settle down, and then go ahead, study them, and then push them as fast and as hard as I can.
Right. We'll take some more questions, but I'll have to take a break here. Remember, Dr. Harsh Vardhan is very optimistic about overhauling the whole system, the whole health sector, and also revitalizing the doctor and patient relationship. We'll have more questions with Dr. Harsh Vardhan back in a moment after a break. Welcome back. You're watching To The Point with Union Health Minister Dr. Harsh Vardhan. Coming now to Delhi politics, sir. You've been the face of Delhi politics in the recently held elections, but there are whispers in the corridor that probably you have been sent to the health ministry on loan because your real post is the post of the chief minister in Delhi.
Uh, it's a very difficult question to answer.
It's a difficult question, or you don't want to answer at the moment?
In the sense that I also really don't know why I have been sent. One day, at one point of time, all my members of the parliamentary board, the election committee, they said, Dr. Harsh Vardhan, you have to go and fight elections for parliament. And then the next thing that they said, you have to fight parliament, but not from your own constituency. You have to fight it from Chandni Chowk, because there we find that you may be the most suitable man to take Kapil Sibal ji head on. So that's how I came into the scene. And I never knew that they wanted to make me the health minister. They made me now. I don't know what they are going to do with me tomorrow, but
honestly tell me, do you really want to go back to the state politics after assuming the chair of the health minister?
I can only say that for me in politics, there is no personal agenda, there is no personal desire, there is no personal wish, there is no personal ambition, there is nothing like personal.
But sir, if Narendra Modi ji asks you your choice, if you have to spell out your choice, what will be your choice, the chief minister or the health minister?
See, it's a very difficult question for me, honestly speaking, because as you know, health has always been my passion. As a doctor, I have always felt that I can do a lot for the people, patients of this country. But Delhi is, of course, also my birthplace. We have spent all our life in Delhi. We have seen it grow, we have seen it deteriorate, we have seen it from all aspects, all angles. So basically, to be able to do something concrete for Delhi, I think that's also definitely one of the you can say desires of life.
So you mean to say that you don't have a choice at the moment?
So I have left it to my seniors. I have left it to destiny and to the God's desire. So ultimately it will be controlled by the God's desire.
Your smile says a lot. I think you know what you are headed for, but you don't want to discuss it on camera at the moment. But no, of course we'll leave it for some other day. But sir, your clean image in the past got the entire state BJP together. But now again rumblings have started. Recently we heard senior leader Jagdish Mukhi hobnobbing with RSS for the post of the chief minister. Do you really feel that the state unit of BJP lacks leaders, lacks faces, and that's where the party now needs to cultivate, to nurture leaders?
No, you see, I would not say that the BJP lacks leaders. You see, if somebody...
No, I'm talking about the state unit of BJP in Delhi.
State unit we have a lot of leaders, you see, but once somebody comes into limelight, or if he's assigned a position of power, then only he gets that type of prominence. But certainly there is always a need to, you can say, nurture younger leaders and bring new faces into the mainstream, so that we think about tomorrow also.
But sir, after your scintillating victory which you had from Chandni Chowk, people are saying that there is no other face except for Dr. Harsh Vardhan during the Delhi elections.
I don't know what people say. It is for the party and the people to assess what do they want. As far as I am concerned, I am certainly for cultivating new breed of leadership, and I am for whatever my party says. I am there, you can say, sincere, loyal soldier. I only look forward to their advice, and I have full faith in their experience, wisdom about decisions that they take.
Okay, so we won't ask you questions on Delhi politics. We'll see what your next step is going to be. But coming now, sir, to the Modi's governance style, the way he has begun. The beginning has been energetic, it has been robust, but the way we have seen the cabinet is formed, don't you think that there is somewhere, there is an over-centralization of authority when it comes to the way the cabinet is functioning at the moment? I could be wrong, but I'm just asking your views on it.
I don't know. I don't know what do you mean by over-centralization. There is a thorough decentralization. There is, I think we are all working in a most autonomous manner.
But sir, when I talk about over-centralization, for example, PMO is micromanaging all the ministries. So
you see, if they are, I don't know, I really don't know if they are micromanaging or not, but if at all they are micromanaging or micro helping or micro observing, whatever it is, I think that's a great thing that they are doing. If the highest level in the country can monitor what the colleagues in the system are doing or what the other ministries are doing, that is, I think, something good. We should not be criticizing it. That adds to their glory and that adds to their working style, because unless you have someone at the top setting up good examples, that is an inspiration for others to work hard and to monitor. If I know that PMO is monitoring me somehow, I will develop the inspiration to monitor my own people in my own ministry.
So you don't believe that it will weaken the cabinet system in any way?
I don't think, because whatever I have been part of a government in Delhi for 5 years. I know the cabinet system, and whatever my experience of last 10-15 days since the time we took oath and had our first cabinet meeting. You see, there is so much of openness in the cabinet meeting. Everybody can put forth his views so honestly, sincerely, in a transparent manner. There is so much of very healthy discussion. It's not that some seniors speak something, nobody can say something contrary to it. We have a healthy discussion in which even the Prime Minister participates. I was very impressed by the way Mr. Narendra Modi conducted these meetings in recent past.
But sir, one minister leading a cluster of ministries, doesn't it leave the minister overburdened and also too much dependence on bureaucracy? Doesn't it translate into that?
I don't know how does it get translated into actual reality with the question that you are asking. But I think if a particular minister finds it difficult, he can always share his views with the Prime Minister and sort of relieve himself of the extra load. A government system always works with ministers and bureaucracy.
But what about too much dependence on bureaucrats? Because that is also another flip side.
I think there should not be too much dependence on bureaucrats, but the bureaucracy and the ministers, they have to work hand in hand. Basically, they have to be planning things together, they have to be discussing things together, they have to deliberate together.
But sir, bureaucracy in every department, be it health or be it other ministries also, is divided at the moment, because we saw bureaucrats functioning during the UPA regime also. So despite a divided bureaucracy, you feel that you will be able to steer clear with them?
I don't think that one should take bureaucracy like the one supporting a particular government or the one not supporting a particular, that's not my way of looking at things. For bureaucracy, and even for that matter the politicians, their prime duty is to serve the country, serve the people, and serve the people rising above all these differences of political affiliations.
So one last question before we wind up. Since the time Prime Minister Narendra Modi has sworn in and all the ministers have sworn in, Modi always has been seen as a taskmaster who's known to get work out of the system. We have seen a sudden change in the culture, in the working environment of the ministries. We never used to see people in the ministries. I'm not talking about this particular ministry, but across the ministries, people never used to land up till 11:30, 12 in the morning. And now suddenly, you know, there is a buzz that we have to work. There is a culture where people are landing up at office at 8:30 in the morning, at 8:45 in the morning.
I don't know. I had been a minister earlier. And we used to work till almost late in the night, and I remember my ministry even worked sometimes past midnight also, and we always used to start our day early in the morning, and we don't have any instructions from any senior minister or for that matter the Prime Minister or his office. We are doing whatever we want to on our own. That's part of our culture. That's how we have grown up. working in BJP, working in RSS. So it's not because...
I was talking to one of the bureaucrats, obviously I'm not going to name from which department he is and who that person is, but he said that, you know, there's a Modi mania. Modi ji se dar lagta hai, isliye ab log jaldi kaam karna shuru karte hain. This was the phrase he actually used, which is why I asked you this question on the work culture.
I don't think it is true. The way Modi ji has a relationship with us, the way he loves us, the way he respects us, the way we respect him, and the cordiality of the relationship is such that it doesn't have that fear or anything. But certainly we take inspiration from his working. He has been an example. He became a symbol of aspirations of millions of people in this country just because of the good work that he did. Right. He became a symbol of hope for
and certainly the good work which he has done has given him the huge mandate. Thanks very much, Dr. Harsh Vardhan. Appreciate your coming on To The Point.
Thank you.